Hi, my name is Ashley Brochu with Palm Beach State's Bachelor of Science Nursing Program, here to perform a newborn assessment. After birth, the newborn is placed under a warmer. That is when you perform the APGAR score. APGAR score is tested between 1 and 5 minutes after birth. It has a category of 5 different topics. One is heart rate, respiratory effort, muscle tone, reflex irritability, and color. Heart rate you want to be between 110 and 160 beats per minute. Respiratory effort should be even and unlabored, between 30 and 60 breaths per minute. Muscle tone should be symmetrical between the extremities. Reflex irritability can be when you bulb suction the infant's nose, if they pull away, cough, sneeze, have the good, nice, loud cry. And then color, the extremities can have some blue to them. That's acrocyanosis on the hands and the feet, and then the lips sometimes. That is normal. It will go away between 24 to 48 hours after birth. A good APGAR score is between 7 to 10. And that, like I said, that's scored between 1 and 5 minutes after birth. There's 2 different times for it. Anything less than 10 requires further intervention. Now, when you go to get the vital signs, you want to do heart rate and respiratory effort first before you take the temperature, because the temperature can upset the baby and give you abnormal reading. So the first thing you do is you assess the respiratory rate. You can either do this with your stethoscope and listen to the sound, or you can watch the chest and the abdomen rise. You count for 1 full minute, because it is normal for babies to have some periods of apnea. Okay, so you watch the chest rise. It should be symmetrical. Like I said, respiratory rate is between 30 to 60 breaths per minute. Then you auscultate the heart rate at the point of maximum impulse. The apical pulse, you assess that for a full minute as well. You should hear S1 and S2 clearly, and it is normal sometimes to hear soft murmur. The heart rate, like I said, is between 110 to 160 beats per minute. Next thing you do is you assess the temperature by taking an axillary temperature. This will make the infant irritable and upset. Normal temperature is 97.7 to 98.6. Next, you move on to the full head-to-toe assessment of a newborn, okay? You want to make sure that they stay under the blanket warmer and are covered appropriately, just to make sure that they're not losing body heat. You start with the head, work all the way down to the feet while assessing reflexes as well, okay? So on the head, you look at the head, you observe for symmetry between the eyes. The eyes are midline, symmetrical, the eyelids open and close, the sclera of the eyes is nice and white, the pupils are equal, round, and reactive to light. You assess the nose, assess for any milia on the nose. It should be midline, make sure the septum is intact and that both nares are patent. Okay? You assess the ears. The ears should be symmetrical with the eyes. You draw like an invisible line, measure that. If the ears are set down from the eyes and they're not symmetrical, it could be a sign of a congenital abnormality. Okay? You want to assess the lips. Like I said earlier, if the lips have some blue to them, that can be the acrocyanosis. Assess the mucous membranes inside the mouth. They should be pink. The tongue should be intact and appropriate size. That should be pink, and the mucous membrane should be moist. Okay? At this point, you can do the rooting reflex, which is if you take your finger and draw it to one side on the cheek, the infant should turn towards that side. Okay? The next reflex is doing the sucking reflex. If you take your gloved pinky and put it in the infant's mouth, they should start to suck that finger, okay? Next thing you move on is to the chest and the thorax. You assess the color of the chest. Is nice and blanchable, quickly blanches back to appropriate color. You assess for any lanugo, which is fine hair over the body, or vernix, which is a cheesy substance that protects the baby in utero after 37 weeks of gestation. The chest should rise symmetrically. It should be cylindrical on both sides. You assess the nipples. Okay, it is normal for both in male and female babies to have some engorged nipples due to hormones during pregnancy. You assess the arms. The arms should be symmetrical with the arm folds. You assess the brachial pulses symmetrically. They should be even with the heart rate. After assessing the arms, you do the chest again. Look at the abdomen. Look for any abnormal masses, lesions, or abnormal skin characteristics. You assess the umbilicus and the cord. Okay, the cord should remain clamped, and the umbilical cord should start to dry, and it's going to feel like a fingertip. At this point, you also assess the 4 quadrants of the abdomen, especially after the baby had a bowel movement already. So you assess the 4 quadrants just like in a normal adult. All 4 quadrants, okay? After that, you can cover the baby's top half, and then we'll cover the baby's top half and then expose their bottom half, leaving the diaper on until we're fully ready to assess the genitalia. All right. On the lower half of the body, you assess the lower part of the abdomen. It should be round and symmetrical, no bulging. Okay. The legs should have also the symmetrical amount of folds. Okay. And then the ankles and the feet, they should be able to rotate. When you release the diaper, you assess the genitalia. On a male, you want to make sure that the urethral meatus is midline and is patent. On a female, you assess the labia. It is normal in females to have some red blood drainage. That is also from the female hormones during pregnancy. All right, at this point, you can also assess the anus. For patency, if you just touch the anus, it should retract and tighten. All right. You assess the legs further. You can do the Ortolani and Barlow maneuvers to make sure that the hips are in place. What you do is you grab the legs and you bend at a 90-degree angle, and you abduct the legs and you bring them back in, okay? There should be no clicking heard, and that the acetabellum should remain in place in the socket, okay? Next step you can go to the Babinski reflex, which is on the feet. You take a finger and draw your finger upwards towards the toes. At this time, the toes should sprawl out. Okay. You can also do the Palmer grasp on the hand. If you put your finger in the infant's palm, the infant should grab your palm, should wrap their fingers around your finger. Okay. Next thing that we can do is the stepping reflex. What we want to do is we raise the infant up, supporting their head, and we hold them sitting up, and they should begin to step. All right. This is present in the newborn. All right. Another thing that we assess for is the startle reflex or the Moro reflex. What we do here is we support the infant's head and in the arm, and what happens is you just startle them by just letting go slightly, and the infant's arm should go out and then tuck back into the body, and the hands will form a C. Okay. At this time, you also want to assess the back, assess the spine, make sure the spine is midline. It is not open. There are no lesions or masses noted. If there is a Mongolian spot, you'll see that in a lot of Asian or African American babies. Okay. You also want to do the Gallant maneuver, which is if you put your finger and you draw it on one side of the infant's side, the arm and the leg on that side that you draw your finger down on will curve inwards. Okay, that is a normal finding. Another test that you want to do is to assess for the tonic neck reflex. What that is you turn the infant's head to one side. On that side, the legs and the arms will extend, and the legs and arms on the opposite side will flex up. Okay. That consists of the newborn assessment. Thank you very much for watching.